Hello and welcome to this learning module. Today we'll discuss EMS response to hematologic or blood-based emergencies. This video is intended to supplement any readings of coursework assigned by your instructor. Upon successful completion of this learning module, students will be better able to describe the pathophysiology of sickle cell disease, assess and manage a patient with hemophilia, and discuss the risks of thrombophilia and anemia. Hematology is the study of blood and blood disorders. The emergencies we will cover today include sickle cell disease, hemophilia, thrombophilia, and anemia. First, we'll start with a quick review of the four components of blood that help to maintain the body's homeostatic balance. Red blood cells contain hemoglobin, which carries oxygen to tissues. White blood cells respond to infection and collect dead cells and provide for their correct disposal. Platelets are essential for clot formation, and plasma is the fluid portion of the blood that serves as a transport medium for blood components, proteins, and minerals. Remember that plasma comprises roughly 55% of the blood, red blood cells make up approximately 44%, and the buffy coat, which includes white blood cells and platelets, comprise less than 1% of blood. Sickle cell disease is caused by an abnormal type of hemoglobin called hemoglobin S. Hemoglobin S changes the red blood cells, or RBCs, and they become fragile and shaped like crescents or sickles. The abnormally shaped cells deliver less oxygen to the body's tissue, and they can also get stuck in small blood vessels and break into pieces. As we see in the image, the sickle-shaped cells can interrupt healthy blood flow and cut down even more on the amount of oxygen flowing to body tissues. Sickle cells also have a shorter lifespan than normal red blood cells, which may result in more cellular waste products as the sickled cells die. This increase in cellular waste contributes to a thickening or sludging of the blood. Sickle cell disease is inherited from both parents. If you get the sickle cell gene from only one parent, you will have sickle cell trait. People with sickle cell trait do not have the symptoms of sickle cell disease. Sickle cell disease is much more common in people of African and Mediterranean descent. It is also seen in folks from South and Central America, the Caribbean, and the Middle East. Almost all people with sickle cell disease have painful episodes called crises. These can last from several hours to days. Sickle cells don't move easily through the small blood vessels and can get stuck and disrupt blood flow. This can cause pain that starts suddenly, be mild to severe, and last for any length of time. Crises can cause pain in the lower back, leg, joints, and chest. Some people have one episode every few years, while others can have multiple episodes each year. The crises can be severe enough to require a hospital stay. Acute chest syndrome is a life-threatening complication in people living with sickle cell disease that can result in lung injury, breathing difficulty, and low oxygen to the rest of the body. Acute chest syndrome may occur when sickled cells block blood and oxygen from reaching the lungs. Acute chest syndrome is a medical emergency, and the patient should be transported to the hospital for treatment. Signs and symptoms are similar to pneumonia and can include chest pain, coughing, difficulty breathing, and fever. Since the sickled red blood cells die early, this can lead to a condition called anemia. Anemia occurs when there's not enough healthy red blood cells to carry oxygen throughout the body. When a person has anemia, they might feel tired, tachycardic, and dyspneic. People with sickle cell disease are more likely to experience harmful infections such as flu, meningitis, and hepatitis. This can cause fever, and this is especially prevalent in infants and children. Hand-foot syndrome refers to the swelling in hands and feet, often accompanied by a fever that is caused by the sickle cells getting stuck in the blood vessels and blocking the blood flow from flowing freely to the hands and feet. Sickle cell disease can affect blood vessels in the eye and lead to long-term damage. Additionally, sickled cells can disrupt blood flow from the brain and cause a stroke. A stroke can result in lifelong disability and learning problems. Younger children with sickle cell disease may also have attacks of abdominal pain. Hemophilia is usually an inherited bleeding disorder where the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. Blood contains many proteins called clotting factors that can help to stop bleeding. People with hemophilia have low levels of one of these clotting factors. The severity of hemophilia that a person has is determined by the amount of factor in the blood. The lower the amount of factor, the more likely it is that the bleeding can occur and lead to serious health problems. Hemophilia occurs in about 1 of every 5,000 male births. Based on a recent study, it used data collected on patients receiving care in federally funded hemophilia treatment centers from 2012 to 2018. It was determined that as many as 33,000 males in the United States are living with the disorder. Hemophilia A is about 4 times as common as hemophilia B, and about half of those affected have the severe form. This image compares the normal clotting process to a person with hemophilia A. Hemophilia affects people from all racial and ethnic groups. Hemophilia in females is rare, but it can happen. EMS should treat bleeding in those with hemophilia the same way as we would any other patient who has external bleeding. This includes direct pressure on the injury location and application of ice. Prehospital providers should encourage patients to administer their factor therapy if they have it available. These patients should be transported to the emergency department for further evaluation and follow-up care. Thrombophilia, also called hypercoagulation, is a condition that increases the risk of blood clots or thrombosis. Thrombophilia may be genetically inherited or may be acquired, which is more common. Acquired thrombophilia can be caused by medications such as birth control pills, prolonged bed rest or inactivity, recent surgery or trauma, and pregnancy. The image on the left illustrates thrombophilia in a blood vessel. Thrombophilia can lead to deep vein thrombosis or DVT. When a portion of a thrombus breaks free from the vessel wall and enters the circulation, it's referred to as an embolus. An embolus that is carried through the bloodstream can be large enough to block a vessel critical to a major organ. So in the heart, brain, or lungs, an embolism may accordingly cause a heart attack, a stroke, or pulmonary embolism. A patient with a DVT may present with persistent pain or cramping in one leg that worsens when walking or standing. Swelling to the calf or thigh area may also be present. Your assessment may reveal redness and swelling as seen in the image on the right. You may also detect that this area is warmer than the rest of the leg. Obtaining a thorough patient history and completing a detailed physical exam are key to recognizing thrombophilia in the field. These patients should be transported to the emergency department for care. Anemia is a condition where there is an abnormally low level of red blood cells and therefore lower levels of hemoglobin to carry oxygen throughout the body. This results in tissue throughout the body becoming hypoxic. It's important to note that a pulse oximeter may indicate adequate saturation levels because of what hemoglobin there is fully loaded with oxygen despite the hypoxic tissue. A thorough history and assessment are key to suspecting anemia in a patient. As we see in the image on the left, common signs and symptoms of anemia include fatigue, weakness, pale skin, shortness of breath, dizziness, heart palpitations, and cold hands and feet. Anemia may be caused by chronic or acute bleeding, deficiency in certain vitamins such as B12 or minerals including iron, or an underlying disease process such as renal disease. Treatment includes controlling any external bleeding and administration of high-flow oxygen. A paramedic intercept if working on a basic life support unit is recommended. The image on the right uses the term hematocrit. This is a measure of the percentage of red blood cells in the total blood volume. This test can be determined in a hospital lab by analyzing a blood sample. The image compares a normal sample with a sample that has a decreased hematocrit due to anemia. Emergency medical care for a patient experiencing a hematologic emergency includes supportive care and management of symptoms. Consider administration of oxygen to maintain a saturation of 94% or better, and place the patient in a position where they are most comfortable. Consider contacting ALS for patients experiencing a sickle cell crisis and for patients with hemophilia who have internal or external bleeding. This brings us to the end of this presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, consider going back to review any content that you struggled with. Thank you for watching this learning module.